is Chris Wolf with the testing sites now expanding.
All right, sir, go ahead and remove your mask. You're gonna go ahead and face towards me, tilt your head up a little bit. You're gonna feel a little pressure here, try not to move. Perfect, good job.
Walk up or drive through, as long as you have an appointment. Healthcare workers in Boyle Heights will test you for the potentially deadly coronavirus.
Hundreds a day.
Wow. All ages?
All ages from infants to the elderly.
The nasal swab testing process takes about 10 minutes, with results coming back within 48 hours. Los Angeles County officials want to make sure underserved communities have access to the much-needed tests. After all, these areas tend to be the COVID hotspots.
I feel like it's actually helping not only an underprivileged community, but it's serving a group of people that are symptomatic, exposed, and especially in this area, there's a lot of people who are living in smaller homes and with more people under one roof.
Well, we need more than just testing. We need resources, we need prevention, we need cracking down on bad players. We just saw over the weekend a manufacturing apparel company having over close to 300 employees who tested positive, and 4 of them, according to reports, deceased.
California is seeing a spike in coronavirus cases, and experts say testing is key to reducing the spread of the potentially deadly illness. The Los Angeles Comptroller says, quote, "It's clear that people of color who live in economically disadvantaged communities are disproportionately affected." His office is tracking the spread of the virus and reports communities with the most overall COVID-19 cases are East LA, Southgate, and Boyle Heights.
If you were a low-income community of color and you were having a hard time before this pandemic hit, you are having a harder time now, and more resources and investment at every level has got to come down to our communities.
That was Chris Wolf reporting just a bit ago. So, Sam, like you were saying, the other thing is, I think if you're healthy, you have really no idea what it has done. But I do think if you're sick, if you feel ill, for instance, and then you get the get the test back in a couple of days, I think it does make you feel better. When, I guess, I don't know, mid-June, early June, I had something, I don't know if it was allergies or a head cold or something, but I had a sore throat and I just felt weird and I lost my voice, and it was very hot, and I think it had something to do with just the Santa Ana's, just being agitated by that. But I did go and get a test, got a test at Dodger Stadium, came back in 2 days, and I knew I didn't have COVID. I felt a lot better, but you're right. It's not effective because people, as we know, I don't think are going to be compelled to do much unless they really feel like they absolutely know that they are going to be spreading it.
Well, and not only is it taking 10 days in my case, 7 to 10 days in my case to get the test back, but, and I'll talk about Rite Aid, I guess, because this has something to do with it. The ability to get a test at CVS, where I've been getting mine, is ridiculous. You have to be on the website at midnight for 2 days later to get the test. Otherwise, the appointments fill up. Rite Aid expanded its COVID-19 testing. Many of its stores are now capable of conducting the tests. This should help in a shortage, but the testing will be available from 10 a.m. to 8 p.m. Monday through Friday, and then 10 to 5 p.m. on Saturdays. You have to make an appointment on their website. And I would not have known to log on and check for that appointment time if I hadn't have called and asked the nice pharmacist or assistant who said, go on at midnight. They're gone by the morning if you wait. So I don't know if that's the case for Rite Aid, but I highly suggest if there are none available near you, get on there right when they go live.
Well, and it's like whoever got the press release on this first before it's now been on TV for 2 days, good work. But I feel like you're right now that everybody's talking about it. Something that is still available if you want to pay for it. I believe Exer Urgent Care, or More Than Urgent Care, which is, they have a lot of locations all over Southern California. I think that you can get a test through there, but you do, like I said, have to pay for it.
$130, I think.
Oh,
right.
I don't know, but honestly, for peace of mind,
our friends got it done and had the test. They got the immediate one to have the test results, so they could they knew right then and there if they were able to see their family for that day. They wanted to know right then and there. Chris, how much was it? $130 each test, so $260 for the couple.
But I mean, worth it if you are gonna do something particularly that big. Like if you're just going about your normal life, I don't know about spending $130 for something that you're not even certain about. If you have no symptoms or anything, why would you go spend $130 for peace of mind if you're not gonna do anything in particularly different than your normal routine? So.
Well, this couple is like planning their wedding, which obviously now is postponed. They hadn't seen their friends and family for a really long time, and they missed out on some big, I mean, we all are. We're all missing out on those milestone moments in other people's lives or family friends' lives. And they were like, we're taking the test. I want to see my parents. So.
Yeah. And also, you talk about money, $130 for peace of mind to know that I'm not going to infect somebody else and potentially cause bodily harm or sickness or death or any of these other things. And also probably it will cost someone money to have COVID-19. I think it's worth it.